Hello, ladies and gentlemen. It's Mike Vonbeardingham here. This evening, I am joined by lovely, significant, other, long-suffering, very charitable girlfriend, Carrie Aldridge. Say
Hi.
hello. There we go. She's very, very nervous, so please make her feel at home.
I'm going to be swinging around in the chair left and right. And
Yeah, I just do that when I need a wee.
I don't need a wee.
Okay. We've got Carrie on here this evening because one of my reasons for doing this, hello Leanne, darling,
Hello, Leanne.
was not only to raise awareness, but it was also to try and get some information out there, as Carrie is currently investigating the fact that she may have endometriosis. Now, for full disclosure, Carrie... Oh, thank you, Anthony.
Thanks.
Carrie has not been diagnosed with endometriosis, but I thought it was really important to have her on because currently what she's going through regarding to getting answers, being passed from one department to another, and all the joys of trying to get any form of answers when it comes to an illness of this nature, she is going through. So we thought it would be really helpful for anybody... Oh, you're too lovely, Leah. We thought it'd be really important so that for people in the same position can see and maybe sort of empathise and just show that you're not alone in this situation. So, where would you like to start?
God, I don't know.
There's just so much ground to cover.
Thank you, guys. Thanks, Thanks, Kit. Hello. I suppose it's just really... It's maybe starting from the symptoms, or how long ago I've sort of started suffering from this, or...
Yeah, so what we're going to do... Actually, what we can do first, I was supposed to show this during the interview with Alex, as she put me onto this piece of information. Now, this is a picture of an iceberg, as you can see. This is a really good representation of endometriosis and what people see and what is really going on beneath the surface. So, as you can see, what people see, abdominal pain, extreme cramps. So, as you can see, that is the tip of the iceberg. If we go down below the surface, we have depression, bloating, possible infertility, diarrhea, heavy menstruation, anxiety, dysmenorrhea, excellent, constipation, fatigue, migraines, weight gain, leg pains, painful periods, and painful intercourse.
I'm sure.
Yeah, it sounds great fun. And not everybody will suffer with all the symptoms, from my knowledge of what we've heard. Some people may have other symptoms as well, but that is a kind of roundabout gathering of all the sort of common symptoms. We looked through that list, and you have, I would say, probably 80 to 85% of what is going on in that list.
I don't know about the child thing, but that's not going to happen anyway. So.
No. So, when do you think, or when did you first start noticing that from, say, your normal everyday health, your normal sort of, I suppose, menstrual health, when did you notice there was a change or any kind of abnormality?
I'd say about 5 or 6 years ago. This is when, quite early on into our relationship, and I had really bad stabbing pains in my sort of womb area, or this abdominal area. And I remember getting tested for cervical cancer. I had all kinds of different tests done. But it was found that I had cysts on my ovaries. I think it was my left ovary, which we must have spent almost 24 hours in A&E that day.
Yes.
That's when you were wearing the little wee pot on your head. I remember that picture. So, yeah, I mean, that's how I believe it started. And then I've had what doctors have called pelvic inflammatory issues. I've had to go to all types of different, what are they called?
Specialists?
No, they started sending me to GUM clinics.
Sexual health clinic.
Yeah, to get tested to see if I had any STIs. That went on for ages. I kept feeling like I had kidney or UTI infections, which was very common for me because I struggled with those for about 10 years prior to seeing you. So I'd get a lot of UTI type symptoms, sort of frequency or urgency to go to the toilet, to go for a wee, a lot of pressure sensation on my bladder. And a lot of the tests that I would take, like the urine sample test that would be sent off, would find absolutely nothing wrong with me. And you'd feel like you're going mad because you're like, it feels something's going on. It feels weird. Like, I don't know what it is. It feels like I've got an infection. And then it would sort of gradually, I'd get really heavy periods. There'd be really the pain, the period cramp. I used to have completely regular periods that would last for maybe 4 or 5 days. They were sort of medium, not ridiculously heavy. And then it went from that to having, I can't think of what, my brain's just suddenly gone now.
It's fine.
So they went like really, that's it. The period cramp itself, it would be maybe I'd get that for the first day. But now the pain is so bad, it's waking me up in the night. I don't know if you remember, like it must have been maybe 1 or 2 years ago, I woke up in the night because it was so bad that you were like, do we have to go to A&E? And I said, I don't know. And it was just, I was sort of getting sweats because it was so painful. And so it then started to get more symptoms. So we've got, to be perfectly graphic, I'm not bothered about discussing this, but discomfort in certain positions if we had intercourse. So we have to be careful in that respect. Usually after we'd slept together, I'd get a lot of sort of aches and pains. So it used to really sort of almost, again, feel like an infection or cystitis or something aching, like if I've held going to the toilet for a couple of hours, like when we went to France and we were driving for 13 hours and I held going to the toilet for like 8. It was almost like that whole sort of having to hold something in, but it could be, I don't know, half an hour where I haven't peed or something like that. It would just get worse and the symptoms just started to sort of get more weird. What are my other symptoms? What are the other sort of things happening? Because this has been going on for about, well, the pelvic issue is about 5 years. Yeah,
the intensity and the pain of your periods. Your periods are now becoming very regular.
Which is odd, well. Very odd.
Yeah, a lot heavier. So
clots as well.
You're having to eat painkillers like there's no tomorrow.
Oh my God, yeah. I've built up a lovely tolerance to Zapain as well, so I can... I used to take one and fall asleep, but I now take like 4 of those a day, sometimes 6, and they don't really have as much of an effect. And it's usually topical ibuprofen, because this seems very common as well. I have reflux or upper GI issues, so I've had those for about 8 to 10 years. Really bad reflux. I've got a hiatus hernia, so I have to take topical ibuprofen. I can't take the pill form because it makes me really sick because of the reflux, I'm assuming. So yeah, I have to basically smother myself in ibuprofen, have hot water bottles, so much so to the point where I have scarring like of my is it like capillaries, like blood?
Where they burst.
So I've got like scarring on my tummy and my back from me constantly having hot things on it because I just can't. It's hard to explain, but it's so painful. You just have to completely try and douse yourself in various sort of painkillers to just try and function. And so, yeah.
One of the things might be worth pointing out is that you were diagnosed with...
What, fibro?
Yeah.
Fibromyalgia. Yeah, I've had that for diagnosed about 2.5 years ago. So March next year will be about 3 years. And that was ridiculous as well. I don't know if you want me to go through the symptoms of that. I don't know if it's related.
Some of them are similar, aren't they? Yeah. Especially, this is the tricky thing, I think Alex was saying as well during her interview, is that a lot of people get misdiagnosed with fibro first, and then they can be diagnosed with endo. I think, quote, please correct me if I'm wrong, but I think that's what she said. And because one of the things that you suffer with a lot, which, as Alex talked about, is fatigue.
Yeah, it's ridiculous. Yeah,
to the point where you're just absolutely exhausted. You don't really want to even move around the house. You just sort of pretty much stay in bed.
Yeah, I mean, that's like climbing up a set of stairs is like going up Everest sometimes. It sounds really overly dramatic to say that, but to climb just a normal stairs in your house, it really puts a lot of pressure on you. It hurts everything. I just get exhausted, and it's hard to explain, but it's one of those types of illnesses that they say that is related to kind of arthritis, or it's within that family. So I seize up a lot, and especially around my hips. So I can be just sitting down after I've been out for a gentle walk with the dogs. I say gentle, but we've got 2 Labradors. So it's not very gentle. But yeah, I can rest for a few minutes and then I'll completely seize up. And it, there's loads of times where my leg's locked, like up here, isn't it? And you've been like, you're right. No, sort of limping out to the bathroom or something.
So if we now take it to where you started seeking medical help, because I think this is one of the things, also I want to point out that when Carrie, and this is, I think, is very important, when Carrie watched, this all sounds very familiar. I feel you. Keep going. You're amazing. Oh.
Thank you.
When Carrie saw Alex's interview, Carrie was very sort of almost felt like she was a bit of a charlatan for coming on this show, because her symptoms and what she's been diagnosed with and everything so far was not on the same level as Alex. That is sort of what we want to completely avoid doing these things. These interviews are not about who has the worst symptoms. They're showing you different stages. Alex had one of the most severe cases, probably as Leanne, who we will see in I think our next interview, has had like extremely bad experiences. But don't forget, there are many different stages to endometriosis. So stage 4 just sounds like absolute hell on toast and nothing you would want to put anybody through. What Carrie is going through, I've watched her suffer with it. It's incredibly painful. It's incredibly demoralising. And even though we haven't got an endometriosis diagnosis, you still don't want to feel that what you're feeling isn't up to par with other people.
Isn't valid, yeah.
Yeah, isn't valid. And this is where being taken seriously by medical professionals can really knock your confidence. And that's the kind of thing that we're about to go into now. So how long ago do you think you started looking into, or going to see the doctors, going to see specialists about sort of trying to push this a bit further than just, you have heavy periods, or the usual gumph that you get told?
I've probably been pushing for about 2 years. I've gone to the doctors, I don't know how many times. The one decent doctor we have at the surgery admits he's not very experienced in it. But it's, oh God, I mean, it's so hard because you'll sort of ring them up and you'll say, right, I've got this symptom. It's unusual. It's not normal for me. And you discuss it with them and they'll kind of go, well, have you taken painkillers? Well, of course, that's like one of the first options you're going to do, isn't it? I've had doctors say to me, well, you can have Buscopan because that's supposed to be really good for IBS. And it's like, well, it's not just that it's a sort of a bit of a cramping. It's stuff that's waking me up in the night and we're debating whether we should go to hospital. It's not like just period cramp. It's like the mother of all period cramps. It's horrible. So yeah, I think with that particular doctor, I've had various sort of, you've come with me before where they've examined me and they've been like, right, okay, well, we're not really sure what this is. They sort of very often keep thinking it's cervical cancer, don't they? Because they'll go, have you got any discharge? Have you got any abnormal bleeding? Are you bleeding during intercourse? And they go over the same sort of protocol. And it's like, no, not really. And so they referred me maybe, when was it? I saw my first gynecologist January this year. So this must have been going on. It was months before I saw this one, like 6 months.
Yeah.
So what, a year and a half? I can't, my brain's not very good.
Yeah, because one of the things they first found out was that you had HPV.
I've had that for 3 years now. It just won't get out of my body.
HPV, and then in which smear, you had your smear, and then you had, what was the one where they actually, they put a probe up and said that we think you have endometriosis behind your cervix?
That was with Mr. Spencer. That was the gynecological appointment I had in January this year. I mean, this year's been so weird. I'm just trying to think. It is this year. He did various examinations. So it was, what do they call it? A vaginal ultrasound or something.
That's just a tool, like me.
Transvaginal ultrasound.
Okay.
So they, the funniest thing was, I thought this might be funny for people, but they noticed that I had a lot of wind. He was like, "Oh, you've got a lot of wind in there," and I said, "Oh, thanks for that." I didn't really notice. But yeah, I mean, so he did that. He did with the speculum and like looking around that way, and then he used his fingers as well. So that was so painful. I remember a week I was really sore. But he said, after rooting around for God knows how long, because I was wondering when this was going to be over with, he said, "I think you have endometriosis behind your cervical wall," or something like that. And he said, "You need laparoscopy to be sure of that." And then in the time it took for me to get dressed again and come into his office, he'd decided against that and wanted to put me on the Mirena coil and tranexamic acid. And I said, well, I don't want to go on the coil. I don't need or want really to have birth control, because my partner, we're not having children. My partner's had a vasectomy. Yes, the world of Facebook has seen that as well. So yeah, I mean, I wasn't very keen on having the coil fitted. And
there's a reason for that, isn't there?
I've seen a lot of... So I'm in an endometriosis group, which is where some of you have come for the interviews. And I've seen a lot of horror stories. I've seen some say that it's worked well for them, but a lot of it is just enough for me not to... I mean, there's like 16,000 members in that group, and there was a lot of posts saying the nightmares that they had with it. So I wasn't keen on using that. And then obviously they've prescribed me with tranexamic acid, and two immediate family members have had deep vein thrombosis. It's how my mum lost her sight. So prescribing me with something that is going to clot my blood doesn't really seem like a particularly very good suggestion for me to take. So I wasn't keen on either of those suggestions. And I wanted to know why I wasn't referred for a laparoscopy. But obviously I didn't have a chance to ask him then. I didn't know that he was going to decide against that between me leaving him and him writing to the doctor.
Did he, when he wrote to the doctor, did he mention that he thought you had endometriosis behind your cervix?
I mean, I've actually requested my medical records, not specifically for this interview, but because we'll go into that, but I have requested it for a reason. And he's just basically put on his notes that he's suggested the is it the coil, the Mirena coil, and to try tranexamic acid and rectal Voltarol, which obviously I haven't tried.
So there's been no mention of the fact that he said, "I think you may have endometriosis."
No, not on this. Whatever this is, the report.
And I don't think he did, because I remember there's so much frustration and anger, because again, it's one of these things where you feel, surely if you think somebody may have something, let's take a really extreme example. If you find something in somebody's body and you think you potentially might have cancer, you don't just go, "Okay, we'll just leave it," or I'll try. You seek to look further to try and actually find out for certain. Mm-hmm. And this should be sort of the case for many, many illnesses. But one of the things that we've noticed in what a doctor actually says, what they write down, and then what information is transferred from one department to another, or for a doctor to a specialist, a lot of the time they don't actually write down the things that you tell them. Mm-hmm. Like where you've, one of the ones you went to recently, and you were talking about, for example, the discomfort during sex, painful orgasms, how things have changed, how, the extreme pain during your periods. They write down certain things, but then they seem to really downplay the severity of, because a person knows their own body. If you are in extreme pain, you are in extreme pain. Mm. So to write down sort of the equivalent of, they suffer some discomfort.
Well, I gave her, I don't want to get this too confused, but you're talking about the second gynecologist I saw, and that was in September of this year.
There's just been so many.
Well, no, if I quickly go back to the previous one. So I hadn't heard anything from the doctors after my examination from the specialist in Chelmsford. So I called my doctor and said, well, what's going on? He did mention a laparoscopy. I know that this is one of the main ways in which you can get a diagnosis. And he said, well, he hasn't put that, but I can ask him, but he's not obligated to reply. And I thought, well, what's the point in that? And that is also in my records that my doctor has written the specialist a letter, but he's had no response. So that's really helpful. So then I pushed with the doctor again and I said, look, I need answers. Like, this is significantly affecting or having an impact on my mental health. It's having an impact, obviously, on my physical health. And something's wrong with you and you want answers. So he referred me again, and I was trying to get a referral to, obviously, I've spoken with Alex throughout this whole time. I have spoken with Leanne as well. And she has actually put a comment there. I don't know if you wanted to.
Yeah, as Leanne said, she wasn't even told she had endometriosis until last week after emergency surgery. Now,
that is just unreal.
Yeah, as we said before on the Alex interview, Leanne was texting updates to Facebook of everything that was going on. Not only extreme, not malpractice is the wrong word, but that's incompetence.
Yeah, it's unbelievable
from
what she had to experience.
What she was going through. But also just the severity of the symptoms and pain that Leanne has suffered. And she said the suffering started long before but wasn't taken seriously. This is why it's so important that it's recognised sooner. So this is why it shouldn't be this way, but you really have to push, because if you do push and you find that through various scans and procedures that you don't have it, great.
Yeah.
Wonderful. Yeah. You can chalk that one down to experience and then see what other avenue you can go down. But again, if you're being fobbed off, if you're being told it's all in your head, if you're just told you're having heavy periods, or just go on this or just go on that, if it's not working for you, then it shouldn't be the case for you not to be taken seriously.
Well, yeah, I mean, as a human being, if you know that there's something wrong with you and something's not right, then those medical professionals are meant to be there to help you. And if they can't help you, then they refer you to somebody that will, i.e. a specialist. But in my opinion, I don't think that a gynecologist is a good enough person to be able to diagnose this. What I will say, because I think we sort of strayed a little bit and that's my fault, but I went back to I was talking about my previous referral in January. The one in September, she was horrendous, but I gave her 2 pages of symptoms. I was saying, I broke down in tears as well. She didn't even, I wasn't expecting her to be like, oh my God, I'm so sorry. But because she was very difficult to she was very sort of, I'm not expecting somebody to get the violins out and be emotional, but she was just very difficult to communicate with. And obviously this is problems down there. You're going to want somebody to be a little bit sensitive to what you're saying.
But that's very similar to what Alex said when she said the female gynecologist she saw. She said she sort of didn't get it.
Yeah, and that is like, as a woman, and I actually said to her, I said, you are a woman I said, imagine if this is what you're going through. I said, you're getting all these symptoms, all these things are happening. It's getting progressively worse. It's worrying you, and that patient is breaking down in tears in front of you. I said, what would you do? And she almost cut me off, and she wanted to examine me. And I can't understand what she would have seen in the 2 seconds she looked up there. But she, according to that letter, she's examined me and come out with all this stuff. But after all that, she just said, you have heavy periods, which I just thought that is the most insulting thing you could say to me, because it's not just heavy periods. I've just listed a lot of symptoms to you. Do
you still have that list?
Yeah, I wrote it on a notepad on my phone. Oh God, I don't want to fall off this chair. Do you want me to read it out?
Well, yeah, because if we look at what you listed to her, and then we actually look at what was written down, and we compare the difference, I think that might be quite helpful to people to see.
Well, yeah, I mean, this is going to be, I don't know if anyone's going to find this awkward, but like I said, I don't have a problem with saying this.
Sit down, get the popcorn out.
Just in case my aunt and uncle's tuned in or something. So I've put discomfort in certain positions, pressure, sensation and pushing on bowel. Usually a couple of days after intercourse, I get aches and pains in cervix and bladder area that last for a few days. Extremely painful and heavy periods, irregular periods, which used to be very regular. Sometimes during my period, this is going to sound horrible, I'm sorry, I can go between getting old blood, heavy normal blood colour and a lot of clotting. My cramp lasts the entire duration of my period. Every other month I get cystitis/UTI symptoms. The month after that is where I get the really bad periods. I get severe headaches and migraines that last for a few days just before I'm due on. I get bad bloating almost every day. Stomach pains, aches and pains in womb and cervix area. Sometimes I get shooting pains, others the pain is a dull ache and travels around these regions. My orgasms are painful. I get chest pains and digestive issues. I have fatigue and exhaustion, and I've put in brackets I also have fibromyalgia. I've just written notes about the two
that's fine.
specialists I saw.
So now let us delve into...
We're not going to do a live examination.
No, but in the stirrups, darling. So where is the actual...
Oh, well, after I saw the female one?
The one who you told all this to. And if we actually look at what she wrote in her notes... This
is all over the place, so I can't...
That's fine. Take your time. Everyone is just letting all those lovely images sink in.
I actually opened it on the page.
Oh, well done.
She did call me pleasant, which is,
So she definitely wasn't paying attention.
So she describes her cycles as being irregular, coming every 2 to 4 weeks and lasting for 4 days. But during these days, she suffers with severe spasmodic dysmenorrhea, requiring painkillers and hot water bottles. She passes 50p size clots and changes pads every 2 hours. All the symptoms are affecting her significantly. There are also symptoms and signs of suggestive of congestion, dysmenorrhea, and dyspareunia. Don't know what that is. I've probably pronounced that wrong. I'm sorry. She has a lot of medical conditions like recurrent cystitis. That isn't a medical condition, and I don't have recurrent cystitis. It's what I've... It basically sounds to me like intercystital cystitis, not cystitis, because I've had cystitis, if that makes sense, and I know that that's not that. She's mentioned a hernia, which wasn't... I don't know if that was even... But then she's put fibromyalgia, which she is under various specialties. I'm not. I was discharged after I saw a rheumatologist that told me I had fibro. She is nulliparous, which I'm assuming we're not having children. I don't know any of this stuff. Her partner's had a vasectomy. She's up to date with her smears. She's mentioned in here dyscariosis, which that's probably precancerous cells that I had in my smear last year. I did that thing. I made that noise when people read stuff. Yeah. She's due for a smear at the end of the year. No significant abdominal surgeries. She's not on any medication and has no known allergies.
So there's a big chunk.
A huge chunk of...
Especially about, during intercourse, which is quite well known on the endometriosis symptoms. So the changing of that. Obviously, she mentioned a lot about your periods, but there were so many other things.
She missed out.
Yeah, and it's just in that exchange of information can be something that can be allow you to be taken seriously. Because one of the things Carrie then has decided is she's going to try and go private for this, and she wants to go and see a private specialist for just a session to maybe sort of try and get a diagnosis or see where to go from there. Yeah. But the fact is, even when you go private, you still have to be referred by your GP.
Yeah.
So if your GP doesn't think or is of the opinion that, no, I don't think it's serious enough for that, you can be held back. You know, you're not costing the NHS anything. You are paying for it yourself. So, and the fact is, as we say, if all of these symptoms are not documented and passed to the relevant parties, then it can just make it look like your condition is less serious than it actually is, which is going to inhibit your chances of being able to push and take it further.
Yeah, it is frustrating. And also what I'll say is at the end of my, when I saw that gynecologist, the most recent one, I said, I kind of went through a plan of action. I was like, well, so what do we do? What is the plan of action? Like where do we go from here? And I said, what about laparoscopy? Because she did actually lecture me for some reason as to why I didn't have the coil. And she said, why didn't you listen to Mr. Spencer's advice? Or she sort of seemed a little bit, but maybe I don't know if you've been to one specialist and then you're going to another one, she's going to want to know why. I don't know. But anyway, I said about a laparoscopy, and she said that they're very evasive, and that she gave me a percentage which I thought was really quite incorrect, and she sort of said that about 45 to 50% of patients don't receive a diagnosis, and it doesn't give you answers. So I'm not sure why you think that you want to go down that route. And I said, well, because I know that is how people get a definitive diagnosis. And she's one of these people that when you mention that you've done your own research, they assume that you've just sat on Google and you've spent 5 minutes researching about it. They don't know that you've
been living the experience.
Yeah, and been digging a hell of a lot. I've been in 2 support groups, I think. I've joined the Endometriosis UK page. There's all sorts of campaigns and things like that you read about and you go into. It's not like I'm convincing myself of it, but it's definitely relatable. And so after I saw her, and she then pushed either the coil or the pill and tranexamic, I just thought, this is just insane. So that's why I called my doctor recently and said, I want to see an endo specialist. I need answers. And he said, okay, well, I'll write you a referral. And the referral was quite laughable because he just said...
do you want to... Is the referral there?
No, it's out. It's in the other room. Do you want me to get it?
No, it's okay.
But the referral was something like, can you have a look at this lady? She thinks she's got endometriosis. And it was didn't even explain... He attached some of my history, but my history was something like...
It was missing really important key parts. It
had something that happened to me in 2000, but not something that happened to me this year, the year before that, and the year before that. It was like a huge gap, and then he'd mentioned my reflux issues, but it was just such an odd, oh yeah, this is some of her history. What about all the other stuff? In the records, you can see the amount of times I've called the doctor's surgery and said, I want this on record. I've got these symptoms. I want this to be put on record. There's pages of me ringing up and speaking to the doctors and saying that this is a new symptom, this is happening, just so I can take this with me to the endo specialist and be like, look, I've been trying to kind of get some answers, because regardless of whether this is endo or not, those aren't normal things to be going on down there. It's not a normal thing.
I think that's kind of, and we'll come to actually, because TL says, seems that here in the US, female issues don't get the same care and consideration as men.
Yeah.
Do you feel that is the same in the UK?
It is absolutely the same in the UK.
Yeah. From obviously, I can only talk from my own experience and the experience of people I know and what people have told me, especially when it comes to gynecological issues. There does seem to be still that school of, well, it's just women's problems.
Yeah.
Now, again, that is just my own opinion. I know I've had various medical scares and issues over the years. I have been seen very quickly. I've had very good treatment, whether it's things to do with a lump in my testicles, whether it was I was getting various lumps in sort of lymph nodey places, so therefore I had to have, scans and various things to check for cancer and things like that. I've been treated pretty well. Okay, that might just be my experience. There might be other women who've had great experiences, been treated really well, but there does seem to be a trend when it comes to, say, gynecological issues, that women tend to be disregarded and fobbed off a lot more. And I think what you're saying, what I struggle with when it comes to kind of a logical thought process is that if we know endometriosis exists, we know that we still don't know that much. I'd say we, like I'm a doctor, but the medical community still don't know a lot about the illness. It's very hard to diagnose. But just because of that, by sort of saying, well, almost trying to put people off having procedures that might shed light, even if it is an invasive procedure, the patient can weigh up the risks and say whether they feel that is something they want to try and go through. I mean, put it this way: if someone is in such pain and discomfort that they are willing to put themselves forward for a procedure like laparoscopy, surely that says something. The same was with Alex. If she just said, "Take out my womb and basically my innards, please," then you know that somebody is in a lot of pain. And if they're willing to go through that, then surely going through a procedure that is going to possibly give you some answers rather than putting someone off. I mean, from what we've heard, MRIs, laparoscopies,
ultrasounds, because my friend, I don't know whether I should bring her name up because I don't know whether she wants to be mentioned. But anyway, one of my best mates, Dion.
We'll call her Bernard.
Dion, I think she was diagnosed through an ultrasound. So an ultrasound, an MRI and a laparoscopy. But I mean, like Alex said, it can be all over the body. It can be in your lungs. It can be, well, I don't know whether she joked about whether it could be in her legs or something like that, but it can be all over your body. So, but the most common one is, I thought, a laparoscopy. Yeah,
we're gathering information. The whole point of doing these interviews is we're trying to gather information and people's experiences. So it's a learning journey for us, as well as I hope for you guys as well. Leanne just said, you can contact Healthwatch UK. They're an independent champion for people who use health services. They need to know about these failings for there to be change. Unfortunately, I don't think they're known about, and poor standards are just enjoyed by too many. There's also some other aspects as well, I think, to that as well. And it comes to, obviously, what's the word? Funding and available services are finite. So whatever your health services, they cannot, especially on something like the NHS, you can't just, there isn't money for everybody. And especially the way the NHS has been treated and underfunded, obviously it's so much more difficult for there to be funding for everyone. But I've forgotten the point I was going for. I will get there. Yeah, we'll all scratch really loudly.
Sorry, I genuinely had
That's all right. But there are, that's it. So even with the underfunding there are also issues which I've been speaking to a few people about and have been made aware of. For example, when you have, like, I was talking to my mother, and my mother had a full hysterectomy. I think hers was more, I'm not sure if hers was more endo related or more cervical cancer related.
It was cervical cancer.
Cervical cancer.
Yeah.
And there seemed to be, and anyone out there, probably, I mean, my mum's in her 70s now, so anyone of that kind of age group, if you've experienced having a hysterectomy, how many obstacles do you feel were placed in the way to almost prevent you having that? Or did you feel that it was something they were quite open to, something that it was kind of a smooth path and an obvious
solution?
Because what I've been told is that because of also people suing the NHS and also people suing various medical establishments, saying that you've taken away my choice to be able to have children, even if that is what they agreed to, you can obviously, for suing people, because I wasn't of sound mind. It therefore makes medical institutions less willing to take risks when it comes to certain very invasive procedures. So again, how much this plays into the whole narrative, we don't know.
Is it the expense of how much a laparoscopy is? Because we looked at how much that was going to be.
Yeah, so they're incredibly expensive. And again, you're paying an expense in which you don't know. I suppose if they think you've got a 50% chance of getting an answer, to them, paying out for that procedure isn't overly viable. But then we have to weigh it up against how much is a human being's health worth. So if there are other this is what I don't understand. If there are other procedures like MRIs, what was the other one you said? Another scan? Ultrasounds. Yeah. If they are also known for diagnosing endometriosis or helping, then surely they should be used as well. It's a very, very tricky situation, and that's why we want to try and look at this from all the different angles as to, say, build up a picture of why women seem to be treated like this when it comes to this illness.
Or not, as the case may be.
Oh, yeah, whether they're treated or not treated. But regardless of the obstacles put in place, my hysterectomy was booked with nothing more than an ultrasound over a year ago. So, yeah, in that case, it seems that you had a lot more smooth sailing. But I also know as well with women and men as well, when it comes to, for example, if you don't want children and you know that you don't want children and you want to either be sterilised or have a hysterectomy or anything along those lines, you are pretty much tried to be convinced to go the other way. When I had a vasectomy, I had to really enforce the fact that I didn't want children. I wouldn't be with a partner who didn't want children. They seemed very reluctant to do anything.
They were when I asked about a hysterectomy.
Yeah, because to them it's, again, then could somebody sue them afterwards if they changed their mind?
I think from her perspective, she was talking about having to go, I don't know if HRT is really expensive on the NHS. Yeah.
Oh, right. So Leanne's experienced sort of the flip side of the coin. They didn't investigate what was wrong with me. Had kids? Great. Let's take it out. I felt so dismissed. So that's
like another angle.
Yeah, that's another angle, but that's an opposite of what people we know have experienced when it comes to this kind of thing. So it does seem to be, in that aspect, very up and down.
Well, it's just, I think, because I was reading about, is it type 2 diabetes? So endometriosis is as common as type 2 diabetes. There's like millions of people that have it in the UK.
I think it's 1 in 10.
Yeah, but I think I read, I saw a report about how many people at the moment in the UK have endometriosis, and they said that it was, around about the same amount of people that have type 2 diabetes. But there's obviously more funding that's gone into the research for type 2 diabetes, but not enough funding. This was a woman that works for the BBC. She did an interview and she was talking about some of the facts of it there, but she was saying that she just can't believe how, because they had a doctor on the show or a specialist, and he said that the simple fact is that people don't know enough about it, but why? Like, it needs to have more things done about it, like more research, like, or more awareness, which is what is the sort of brainchild of this idea, because we want to try and create awareness for it, and talk about it, because I don't know, like, there seems to be a very...
Is it still the stigma that it's women's problems? If it was an illness that affected men's genitals at a rate of 1 in 10, how much research and effort would be put into that? Would it be more prioritised? Again, there's a lot of things we don't know. There's a lot of speculation. But the only thing we really do know is that if you are experiencing, again, we can go back to this list. If you are experiencing the vast majority of what you see on this list, things are not normal, and it's not normal to be feeling these things. So you shouldn't have to fight to be taken seriously. And here in America, I got a vasectomy when I was 23, no questions asked. Not the same for women. At that age, they would not even consider it unless it was a life or death situation. So again, we
is it more expensive to do a hysterectomy than it is for? Because it's more expensive for dogs.
It's because it's a much
female
more
dogs.
Yeah, it's a much more invasive.
Not that I'm calling
surgery.
Dogs.
But again, is there a hypocrisy there? We're just looking for more answers. We're looking for more information. We are looking to learn as we progress through these interviews. But as we were saying, if you are suffering and you are feeling like this, try not to be put off. Do not be fobbed off. Don't be made to feel that your symptoms are just women's problems and just go and take some painkillers and just deal with your heavy periods.
Take some Buscopan, that'll help.
Yeah. You know your bodies, you know when something is wrong. And if you're living, whether it's just on your menstruation week or whenever it is, if you are in such excruciating pain, then it's not right. When I was in my 20s, the hospital found I had an inflamed ovary. Is that what you...
I had cysts on my ovaries.
After I had severe cramping pains that put me in hospital, but instead of doing anything about the inflamed ovary, they took my appendix out. Interesting. It was never looked into and was an awkward conversation if I ever brought it up. They actually took an ultrasound of it while I was under surgery. So... what followed up from that? I'm trying to understand. They actually looked at an ultrasound of it while I was under surgery. So
what did they find? Yeah. What was it?
So what? From since then, they've sort of not acknowledged you had the. They discovered that you have an inflamed ovary, or let us know what sort of happened with that. But yeah, so we hope this has been of.
Fairly informative, anyway.
Fairly informative. Excuse my kind of rambling on this subject, because, as we say, I'm still learning. I'm still trying to figure things out, and I'm trying to bring as many avenues and angles as possible into why the situation is like it is.
And I also hate cameras as well, so that's probably why I'm not really very happy.
So any information that any of you guys, through experience or knowledge, or anyone in the medical industry who has another take on things... So as Leanne had a different take on when it came to her having a hysterectomy, please let us know, because it's all information that we can use. They've done nothing and it was ignored ever since. You both did great. Thanks for sharing. Oh.
Thank you. I think you're being too kind, but thank you.
Right. So thank you very much for joining us, everybody. We will be interviewing, I believe, Leanne on...
Is it the 17th? Why do I have the 17th in my head?
When am I interviewing you, Leanne? Let me know. It on our outro, it will say. So thanks very much, everyone. Take care. Enjoy your weekend, whatever you may be doing. Whatever you may be doing. There's a rocket launch tonight.
Have you had some gin as well?
No, I'm just crap at talking. Tuesday, 7:30. There we go. Right, thanks very much, everyone. So there's a rocket launch tonight to watch at 10:15, so...
That's what we'll be doing then, is it?
Yes.
Okay.
Come on, space is cool.
It is cool.
All right, everyone. Take care. By the way, we do have, I think, about 4 more interviews lined up. There is some more in the pipeline, so hopefully we are going to get our quota of 10. And once we've got a few more under the belt, I am hoping, and I'm going to push for this, that we can get an interview with endo specialist. I'm going to send him some information, and this is the one that Alex has been seeing, and
The one that I want to see.
and the one that Carrie wants to see recommended. Whether it will happen or not, who knows? They're very busy people, and they don't know me from Adam. But if I can, I will try. So all the best, everyone.
See you later.
See you later. Bye bye.